Welcome to Guide Mia. Today we're going to talk about simulating lateral excursion in Cympha Studio. This is for orthodontists, prosthodontists, and lab designers who want a quick visual check of how the mandible moves laterally against the maxilla, for consult discussions, plan sanity checks, or occlusal clearance review. By the end you'll know how to start an articulation session two different ways, from a loaded Ortho Plus case, or from two standalone jaw scans, how to position the occlusal reference plane, how to set the lateral limit and scrub the simulation, and how to read the clearance and collision graph at a high level. The articulation itself takes 5 to 10 minutes once your scans are in. Loading and registering the scans is the part that takes time. Follow along on screen, or listen now and read the written guide later. Set expectations first, because this tool is honest about its scope. Studio's lateral excursion is a visual review tool. It is not a TMJ diagnostic, and it is not a substitute for a physical articulator. What it does is animate a lateral mandibular path against a translucent occlusal reference plane, while a small graph tracks three quantities as the simulation plays: penetration, meaning tooth-on-tooth interference, plus the gap on the left side and the gap on the right side. That's exactly the right amount of machinery for the jobs it's built for: talking a patient through a consult, sanity checking a plan before it ships, or reviewing occlusal clearance at chairside. Keep that framing in mind and the tool will serve you well. There are exactly two doors into an articulation session, and you need one of them. Door 1, an Ortho Plus plan loaded in Studio, the GVW review file. The case already contains upper and lower tooth meshes in the same coordinate frame, so no extra scan files are needed. This is the fastest path. Door 2, two standalone jaw mesh files, typically an upper and a lower arch from the same patient, taken in occlusion or close to it. Those are the only two ways in a case, or exactly two meshes loaded through the dedicated menu item we'll see in a moment. Everything happens at studio.cympha.com, and nothing in this workflow needs an account or a sign-in. Let's walk each path. Path A: load the case from the hamburger menu with Open Ortho Plus Plan, and wait until it finishes. The arch toolbar and the floating case bar appearing are your signal that it's ready. Make sure both jaws are visible. On the arch toolbar at top center, that means both arches, not just upper or lower. Then click the articulation icon, the jaw icon, on the top toolbar. Studio prepares the session. It merges the upper and lower tooth surfaces and computes a default occlusal reference plane, which appears in the view as a translucent rectangle with a normal arrow and drag handles. The Simulate Articulation dock opens alongside, holding the graph, a lateral limit field in millimeters, and run and stop buttons. One behavior to understand: that icon never opens a file picker. With a case loaded, it always uses the case. With no case and no stored mesh pair, it just shows a hint on the status line explaining what to do. That hint is normal, not an error. Path B is for when you have an upper and a lower arch scan but no full case. From the hamburger menu, choose Simulate Articulation. A file picker opens, and here's the strict part: select exactly two mesh files, the upper and the lower jaw. 3 is too many, 1 is too few, and Studio rejects any other count with a message on the status line. Both meshes load into the scene, and Studio remembers them as the articulation pair for the rest of the session. The occlusal plane appears and the dock opens, exactly as in Path A. And that remembered pair pays off later. If you close the dock or wander off to do other work, you can come back and click the articulation icon on the top toolbar to reopen the simulation without the file picker, as long as both meshes are still present in the scene. Before you press run, get the plane roughly right. It defines the occlusal reference for the whole simulation. The arrow sticking out of the plane is its normal vector, and it must point toward the upper jaw. Follow the in-app hints if you're unsure which side it's on. Drag the plane's handles to translate or tilt it. How much work this takes depends on your path. For an Ortho Plus case, the default placement follows the app's case rules and usually needs only minor adjustment. For two standalone scans, the default is computed from the bounds of the meshes, a much rougher guess, so expect to tilt it to match the patient's natural occlusal plane, roughly the line from the incisal edges to the molar cusps, parallel to Camper's plane in most patients. Whatever you said is kept for the rest of that case session, so you position it once, not before every run. Now the run itself, which is pleasantly simple. In the dock, set the lateral limit in millimeters. That's how far the lateral excursion sweeps. Click Run. Playback begins from the centric frame, approximately 0 lateral excursion, and moves along the lateral path. Watch two places at once: the three-dimensional view, where the lower jaw sweeps laterally against the plane, and the graph in the dock, which updates as it plays, tracing collision, negative clearance, meaning tooth-on-tooth interference, plus the left gap and the right gap as the excursion progresses. When you've seen what you need, click Stop. You can stop at any point in the excursion and inspect the contact geometry directly in 3 dimensions. Left drag rotates the camera, middle drag pans, and right drag where the scroll wheel zooms. The graph is a high-level summary, not a precise contact map. Read it accordingly. The collision trace shows interpenetration between the upper and lower surfaces at each lateral position, tooth-on-tooth interference. The left gap and right gap traces are the clearance on the working and non-working sides. In a clean lateral excursion, clear aligner plans, balanced occlusion plans, you expect a non-zero gap opening up on the balancing side as the excursion progresses. And here's the diagnostic pearl: a spike in collision near centric usually doesn't mean the teeth are wrong. It usually means the plane isn't quite right, or the bite registration on the source scans is off. So before you draw clinical conclusions, adjust the plane and run again, or re-articulate the source scans. When the graph and your clinical expectation agree, then it's telling you something real. How do you know the session was a good one? The simulation plays smoothly from one lateral extreme to the other and back, without the lower mesh visibly clipping through the plane. The collision trace is clinically reasonable, close to zero at centric, or showing only the contacts the plan calls for, and increasing on the working side as the excursion moves through canine-protected occlusion. When you find the view that shows the contact you want to discuss, keep it. Click the camera icon on the top toolbar for a screen capture. Studio captures the viewer as an image, prompts for an optional comment, and files it in the media gallery. For a fuller record, save the whole project from the hamburger menu with Save Project As. The Cympha project bundles the meshes, the plane state, and any gallery captures, so the session travels with the case. There are 6 things that commonly go wrong, so let's take them in 2 passes, 3 here, 3 next. First, you click the articulation icon and nothing happens except a hint on the status line. That means no case is loaded and no stored articulation pair is available. Neither door is open, so the tool has nothing to work with. Use Simulate Articulation from the hamburger menu to load 2 jaw files, or load an OrthoPlus case, and then the icon works. Second, the plane's arrow points the wrong way. The arrow is the plane's normal, and it must face the upper jaw. Drag the plane handles to flip it, and read the in-app hints before you press Run, because they reinforce exactly this. Third, Run does nothing at all, or the simulation jumps but doesn't animate. Usually one of 2 things: the meshes are too far apart for the lateral limit you configured, or the plane is sitting well away from the occlusion. Bring the plane into the occlusal region, and confirm the 2 meshes really are in or near occlusion. If they aren't, use the gizmo on the moving mesh to bring them together first. And the second 3. Collision that reads enormous and constant, from the very first frame, means the 2 meshes are interpenetrating before the simulation even starts. Double-click the lower mesh and hinge it open with the gizmo until centric is clean, then run again. Articulation expects a roughly closed bite as its starting pose, not a crushed one. Next, the file rules, because this trips up almost everyone once. Simulate Articulation accepts exactly 2 mesh files in the same selection. 1 file is too few and 3 is too many. There's no partial acceptance and no picking the first 2 for you. Reselect precisely the upper and the lower jaw scan. And finally, a format boundary worth knowing before you plan your day around it. A step archive, the .pac format, can drive the case bar's step playback, but it does not drive the same articulation path that a Guide MIA review file does. If you need full articulation from a case that only exists as a step archive, you have 2 options: convert the underlying case to the review file format, or take path B and load the upper and lower meshes exported from that step archive as a standalone pair. All of this is written up, hint by hint, at cympha.com. Open Docs and find how to simulate lateral excursion in Cympha Studio. If these lectures help, subscribe to the series. We're walking through every Cympha workflow, one at a time. Thanks for watching, and catch you in the next one.